Today I would like to describe the ultrasound of the testes. This is the normal ultrasound of the testes, right testes. This is A image, this is B image. Here we have taken measurement of the testes. This is the, you can see that this is the longitudinal scan, and this is the transverse scan. For example, in longitudinal scan, how we measure the ultrasound? For example, you have to measure the length and AP diameter. In transverse scan, you have to measure the width from here to here. This is the width, and on the longitudinal scan, this is the length, and this is the AP diameter. The normal diameter of the testes is on the length is 3 to 5 centimeter length, and the this is the AP diameter. AP diameter normal is up to 3 centimeter. On the transverse scan, there is normal diameter is 2 to 4 centimeter of the width. This is so. This is the length. This is the AP diameter, and this is the width of the testis. So if the measurement is increased or its volume is increased, then we can say that testis is enlarged or not. In this image, there is also this is the hyperechoic line. You can see that this hyperechoic line is the mediastinum of the testes. Another term is used which is called the reed testes, and which where it appears as the hypoechoic area in the hilum of the testes. This is the mediastinum of testes, and another term reed testes is used, which is not shown here, which appear as the hypoechoic area in the hilum of the testes. This is the color Doppler of the image of the testes. Here, this is the low resistance waveform. You can see this is the low resistance waveform. Normal RI is 0.62. You can see this is the diastolic and this is the systolic. So this is the low resistance waveform. In this image, you can see that you can see the normal anatomy of the testes. This is the testis, and this is the epididymis. Epididymis. You can see this is hypoechoic on the ultrasound. This is the head of the epididymis. Head, body, and tail. There are three parts of the epididymis: head, body, and tail. And the normal size of the epididymal head is 5 to 12 mm, and the body is 2 to 4 mm, and tail is 2 to 5 mm. In a condition like epididymal orchitis, its size is increased with increased flow on the color Doppler. This is the normal anatomy of the testes. This is the image of the hydrocele of the testes. This is anechoic fluid around in the testicular scrotal sac. You can see this is the collection of the fluid, and this is the testes. So this is the case of the hydrocele of the testes, collection of the fluid in the scrotal sac. In this image, you can see this is the collection of the fluid in the spermatic cord region. You can see this. This is called the spermatic cord hydrocele. It has two types. Number one, it has two types. The most common type is number one type is the encystic spermatic cord hydrocele. Number two type is the funicular type. In the funicular type, this anechoic collection is connected with the peritoneum, while it is not connected in case of the encystic spermatic hydrocele. So this is the case of the spermatic hydrocele, spermatic cord hydrocele. ये anechoic fluid collection है spermatic cord region में. This is the case of the testicular macrolithiasis. There are multiple echogenic shadows. You can see that these are noted. These are measured up to 1 to 3 mm in the diameter. You can see that. This is the case of the testicular macrolithiasis. Their number is less than 5 mm or more than 5 mm, and it is associated with some of the tumor like the germ cell tumor. So this is the case of the testicular macrolithiasis. Ecogenic shadow, non-shadowing structures are noted throughout the testes. You can see this. So this is the case of the testicular macrolithiasis. Its hypothesis that it is associated with sometime with the testicular cancer, like germ cell tumor. This is case of the varicocele of the testes. Multiple dilated uh, tympaniform plexus of the veins are noted at the upper pole of the testes. So this is the case of the varicocele of the testes. There are many grades of the varicocele of the testes. Grade 1, 2, and 3. This is based on basically on the diameter of the veins, testicular vein, and also on the reflux. So there are three grades of the varicocele. Grade 1. In grade 1, there is diameter is 2.5 to 4 mm, and it is increased up to 1 mm during Valsalva maneuver. In grade 2, there is the size is 4 to 5 mm. It is increased up to 1.2 mm during Valsalva maneuver. In grade 3, its size is more than 5 mm, and its size is increased during Valsalva maneuver more than 1.5 mm. So there are three grades basically: grade 1, 2, 3. Grade 1 size is 2.5 to 4 mm, grade 2 size is 4 to 5 mm, and grade 3 size is more than 5 mm. And during Valsalva maneuver, grade 1, the testicular veins are dilated up to more than uh, 1 mm, during grade 2 1.2 mm, and during grade 3 1.5 mm. So this is basically a grading of the varicocele, which is very important. And when you are doing the ultrasound of the varicocele, patient should not be in the standing position. This is very important to rule out the reflux and the uh, to quantify the grades of the varicocele. This is the cystic area in the epididymal head. You can see this is there are some septa in it. So this is the case of the uh, epididymal cyst. Difference between epididymal cyst and spermatocele is that in spermatocele there are low-level internal echoes, while in case of the epididymal cyst there are no internal echoes. This is case of the epididymal cyst. This is case of the spermatocele. Cystic area is anechoic cystic area is noted in the epididymal head. There are low-level internal. You can see that. You can appreciate that there are low-level internal echoes. So this is the case of the spermatocele of spermatocele. So this is the case of the spermatocele. In this image, you can see of testes, there is a hypoechoic mass in the testes. You can see that there on the color Doppler, there is increased flow on the color Doppler image. So this is the case of the seminoma of the testes, germ cell tumor. So when you can see that there is solid hypoechoic mass, you can confidently label it as the testicular mass. On color Doppler, there is increased flow. This is another case of the ultrasound of the testes. You can see the epididymis in large hypoechoic. On color Doppler, you can see that there is increased flow in the epididymis region. Also, on color Doppler, there is increased flow in the testes. Epididymis is enlarged, hypoechoic, and there is increased flow on color Doppler, and the testes, there is increased flow on the color Doppler. So there is also scrotal wall thickening, which is not mentioned here. So it is the case of the epididymo. So you should rule out the always the epididymo when a patient came with the pain in the region of the testes. So there are main differential are testicular torsion and epididymo. So this is the case of the epididymo. This is another picture of the ultrasound of the testes. This is the area. You can see that this its echogenicity is similar to the testes. So this is the case of the appendix testis. You can see that. So appendix. What is the appendix testis? This is the testicular tissue between the upper pole of the testis and the head of the epididymis. This is seen mainly in case of the when the hydrocele there is present hydrocele in scrotal sac. You can see it clearly. So this is the case. Measurement is 1 to 4 mm. 1 to 4 mm. So this is the accessory testicular tissue. This is the case of the Tarian of the appendix testes. So the appendix testes are enlarged, you can see that, and this is a hypoechoic, and its size is more than 6 mm. So on color Doppler, no flow is noted. So this is the case of the Tarian of the appendix testes. In this case, you can see the right testes, left testes. This is the right testis, this is the left testis. On color Doppler, you can see there is flow in the right testis. While left testis is slightly enlarged and hypoechoic, on color Doppler, no flow is detected. This patient came with the history of the pain in the left testis. When we did the ultrasound, there is no flow in the left testicle. So this is the case of the testicular tirion. In testicular tirion, testes will be enlarged, slightly hypoechoic, and there will be no flow on the color Doppler image. So this is the case of the testicular tirion. This is the case of the scrotal hernia. You can see that this is the mental fat, and uh, there can be gut. Momentum depends on the type. In gonoscrotal hernia, there will be gap in the inguinal region, and the also the mental fat or gut can be appreciated in the scrotal side. So this is the case of the scrotal hernia. This is the case of the epidermoid cyst of the testes. You can see alternating layer of the hypo and hyperechogenicity are noted, and this is the case of the epidermoid cyst of the testes. So today I have discussed the various ultrasound image and the various pathologies which are important in case when you are doing the daily ultrasound cases. So these cases are very important. So testes, you should know the testicular normal measurement, how to take the normal measurement of the testes, and you should also know that about the its radiological ultrasound anatomy, and basically testicular testis ultrasound is very important in case of when you are doing the general ultrasound. So you should concentrate on the various images of the ultrasound. So I will repeat some images in a quick way.